Hi, my name is Alana. I'm going to show you how to do a subcutaneous injection. So what I want to do first is I want to check my physician's orders and my patient's EMR. So I see that my patient has an order by the doctor to be given dalteparin 5,000 units subcutaneously at 0800. Okay, so I see that's the only medication to be given at 0800. And then what I want to do is I want to look and see if my patient has any allergies. So in this case, my patient has no known allergies. So then I will proceed. Okay, so next I will open up my med cart and I will remove dalteparin. And I see here that what I have on hand is 10,000 units per mil. So the doctor's order is 5,000 units. So I know right there that I need to do a math calculation. So I'm just gonna grab my pen and paper and I'm going to write 5,000 units, which is what the doctor's order, divided by 10,000 units per mil, which is what I have on hand. And that will give me 0.5 units of dalteparin. Okay, so after the calculation is done, I want to close my med drawer and I want to prepare everything. So in this case, I want to make sure that I have all the supplies that I need. I have alcohol swabs, I have the needle, the right size needle, blunt needle, and I have gauze and gloves, and that's everything that I need. So I have everything. So now I'm gonna get the needle ready. I'm gonna withdraw the medication. So I'm just gonna move this closer so you can see. Okay, so first what I want to do is I want to clean the top of the vial. I'm going to use my alcohol swab and I'm going to clean it using a circular motion. Okay. Once that is done, I'm going to open the vial. I'm going to take my needle. So in this case, I'm using an insulin needle because the medication is ordered in units. And I have my blunt needle on top. So I'm going to remove the cap. Okay. I am going to withdraw the amount of air that I'm putting into the vial. Sorry, I'm going to withdraw 0.5 units of air because that's the amount of medication that I'm taking out. Okay, next what I want to do is I want to insert the syringe in the middle of the rubber. Okay, and then I'm going to insert the air. Next, what I want to do is I want to withdraw 0.5 units of dalteparin into my syringe, making sure that the top line of the plunger is matched up with the line of 0.5 units. Okay, so that's done. Making sure, just double checking, making sure it's the right dosage and making sure that there's no air bubbles. Okay, then I'm going to recap my needle using the scoop method. Okay, there we go, it's recapped. And then I want to dispose of my blunt needle into the sharps container and put on the appropriate needle the appropriate size needle that I'm going to be using on my patient. So if I were to be using an ampule, which is little glass vials, I will take my alcohol swab and I'm going to clean the neck. Okay. Then I'm going to use my swab and I'm going to break the ampule away from me and then dispose of the glass in the sharps container. Next, what I want to do is, again, I want to use the same syringe, blunt needle, remove the cap. Okay, I'm going to insert the needle into the ampule. And then I'm going to withdraw 0.5 units, making sure my needle isn't touching any external edges of the ampule. Okay, so that's done. Again, I want to make sure that I have 0.5 units in my syringe and that there's no bubbles. So I'm going to use the scooping method again. Okay, and then I'm going to remove my blunt needle and I'm going to put it in the sharps container and put on the appropriate size needle. Okay, so next what I want to do, so now that my syringe is ready, I am going to do my third check. Okay, so I have the right patient, Miss George. I have the right medication, dalteparin. I have the right dose, 0.5 units according to my math calculation. I have the right site, which is in the abdomen, the right route subcutaneously, the right time 0800, the right frequency once a day, and the right reason for DVT. Okay, so now what I want to do, because my medication is heparin, I want to verify with another nurse that the correct dose is in this syringe. So then I'll have the other nurse sign off on it, and then we're good to go. So then I'm going to bring my med cart into my patient's room. Okay. I'm going to bring my med cart into my patient's room. I'm going to perform hand hygiene, and I'm going to say, "Hi, Miss George. My name is Lana. I'm an RPN. How are you doing today?" Okay, Miss George is fine. I have doctor's orders to administer dalteparin injection. Do I have your consent? She gives me consent. Okay. So what I want to let you know is that dalteparin is an anticoagulant, so it'll help prevent your blood clots that you have now from getting any bigger. And so I have my med card here, and with dalteparin it says that the side effects is it could cause excessive bleeding, so I will let my patient know just to be careful not to hurt herself or cut herself, and that it could cause bloody stools, it could cause vomiting that looks like coffee grounds, and bruising. Okay, so I've educated my patient on that. She has given me consent. Next, what I'm going to do is I'm going to say, "Okay, can I please have your name and date of birth?" Okay, she gives me her name and date of birth. I confirm her name and date of birth on her wristband to the EMR. And then I say, "Ms. George, do you have any allergies?" Okay, no known allergies. And then what I'm going to do is I'm going to explain the procedure. Okay, I'm going to insert a needle into your abdomen. You'll feel a slight pinch, but it shouldn't hurt at all. Okay, everything's good to go. So I have chosen the abdomen for this sub-Q injection, but the other locations for sub-Q injections could be the posterior aspect, outer aspect of the arm, which is the fatty part. Then you turn around and then you could do the scapular area, the fatty part of the scapular area, the fatty part of the dorsal gluteal area, and the anterior part of fatty part of the thighs. But in this case, we're going to be doing the abdomen. And because it is heparin, I want to make sure that it's 10 centimeters away from the umbilicus. Okay, so I will move that closer so you can see. So this is my skin. So what I want to do is I want to perform hand hygiene, I'm going to perform hand hygiene, put on some gloves. Okay, and I want to clean the site. Again, 10 centimeters from the umbilicus. And what I'm going to do is I'm going to pinch the skin, and I'm going to clean the site using a circular motion. Okay, after I clean the site, I want to let that air dry, making sure I'm not going to blow on it or use my hands. Okay, and I'm going to put my gauze in between my fingers like this. My site is dry. I'm going to remove the cap. Okay, I'm going to hold the needle like this. And when I'm inserting it, I'm going to insert it at a 90-degree angle. Okay, Miss George, so I'm going to pinch the skin. Okay, Miss George, you're going to feel a slight pinch in 1, 2, 3. Okay, and I'm going to hold it there for 30 to 60 seconds because it is heparin. Okay, so I've held it for 60 seconds. Sorry, I'm going to insert the medication, hold it for 30 to 60 seconds, and then I'm going to let go, and I'm going to apply slight pressure to the site. Okay, and then I will have a safety device on this, and then once that is secured, I will put it into the sharps container. Okay, so either I'll ask the patient to hold it or I will apply tape. Should be good to go. Okay, Miss George, how are you doing? Okay, Miss George is okay. So now I'm just going to remove my gloves. And I want to make sure that Miss George has her call bell within reach, and I will ensure her that I will be back in 30 minutes. And then I will take my med cart, I will leave the room, perform hand hygiene as I'm leaving, and then I will sign off on the EMR that I have given the medication. Some medication has been given subcutaneously, how much I gave, how the patient, how much I gave, and the type of needle that I used, the site, the location. So after that's done, I'll make sure that my med cart is locked, and that's everything for subcutaneous injection. Thank you for listening.